Good morning, ladies and gentlemen. My name is Abie Kalaiwa. I'm a medical doctor, and I'm here to talk to you about Lassa Fever. Over the past 3 months, Nigeria has experienced substantial increase in number of new cases of Lassa Fever. At least 387 people have been diagnosed as having this disease, of which 87 have been confirmed by laboratory means. 40 people so far have died, and of these 40 people, 2 are doctors and 4 are nurses. Lassa fever is an acute viral disease caused by the Lassa virus. This means that the germ responsible for Lassa fever is a virus, and one of the key features of the infection is that it causes hemorrhage or bleeding in different organs of the body. The virus was first identified in 1969 in the town of Lassa in Borno State, Nigeria, in the Yed-Seram River Valley at the south end of Lake Chad, when 2 missionary nurses died from the infection. Although the virus was first described in Nigeria in 1969, Lassa fever as a disease was first described in Sierra Leone in the 1950s. Rats known as multi-mammate rats or Mastonis latalensis spread the Lassa virus. They usually measure about 24 centimeters in length, and the tail is about equal length with the body. These rats are usually household rats and often prey on human food. Infection occurs when an individual is exposed to direct contact with the virus or with the excreta of the rats through contaminated food or material. Infection also occurs between humans through direct contact with the blood, urine, feces, or other bodily secretions of a person with Lassa fever. Person-to-person transmission occurs in both community and healthcare settings, where the virus may be spread by contaminated medical equipment such as reused needles. Sexual transmission of Lassa virus has also been reported. Lassa fever does not produce any symptoms in 80% of infected individuals, but it can be deadly in the remaining 20% by affecting several organs in the body, such as the liver, the spleen, and the kidneys. Typically, the infected person will develop a number of symptoms after about 6 to 21 days following infection. These symptoms will include fever, general weakness, and a feeling of illness. After a few days, headache, sore throat, muscle pain, chest pain, nausea, vomiting, diarrhea, cough, and abdominal pain may follow. Severe cases may progress to show facial swelling, fluid in the lung cavity, bleeding from the mouth, the nostrils, or gastrointestinal tract, and low blood pressure. Protein may also be noted in the urine. Deafness occurs in about 25% of patients, and of these 25%, some of them will recover some hearing function after about 1 or 3 months. The rest will remain permanently deaf. Early treatment markedly reduces the risk of death, and treatment is available through only one drug called ribavirin. Lassa fever affects everyone, from the elderly to the very young, including men, women, and even pregnant women, and the unborn child are all affected and can be infected by Lassa fever. Like with many other infections, prevention is better than cure, as in the case of Lassa fever. Prevention of Lassa fever in the community centers on promoting good community hygiene to discourage rodents from entering homes. Effective measures include storing food, grain, and other foodstuff in rodent-proof containers, disposing of garbage far from the home, maintaining clean households, keeping away rats, and even keeping cats. Because rats are so abundant in endemic areas like Nigeria, it is not possible to completely eliminate them from the environment. Therefore, the mainstay of prevention is to ensure that the rats do not come close to our households and they do not defecate or come in contact with things that we eat. In conclusion, good environmental and personal hygiene is the key to prevention of new Lassa fever infections. Till we come your way next time, have a great day.